Tragus Piercings, everything you should know, well, most of it, before you get it done. Coming up next on Consultations by a Piercer, episode number 13. We're going to talk about Tragus Piercings today, and you should stick around. For those that are new to the channel, welcome to the channel. Hope you're enjoying the videos we have here on the Body Piercing and Tattooing channel. But you might not know who I am. My name is DaVo. I'm a professional body piercer and have been since 1994. I own and I operate the Axiom Body Piercing Studio located right here in Des Moines, Iowa, inside Skin Kitchen Tattoo. I think I said Des Moines twice. Doesn't matter. You know where I'm at now. We're going to talk about the Tragus piercing, or Tragus, I've heard it pronounced. Tragus. Anyway. Whenever in doubt and you're not sure what a piercing's called, just go into your local studio and point to that part of your body, and generally they will know what you want, and they'll probably tell you, oh, that's a Tragus piercing, or Tragus. I don't know. I don't know why everybody wants to put a C in there. I guess I do. I don't know. Anyway, on this one, first thing you should know is average healing time can be 8 to 12 weeks, sometimes longer. It depends on your health and how much tolerance your body has for piercings and how quickly you heal. During that period of time, there's mainly two things we want you to do, and that's mainly to remove that discharge, the crusties. Oh, my God, it's got crusties on it. Ooh, it's gross. It's got crusties. To do that, you want to use a sterile saline solution. I like Nail Meds Piercing Aftercare because it comes out in a fine mist. Other versions you can get, most of them come out kind of like a squirt gun or silly string. The things you want to look for, because I get asked this a lot, is that it is in a pressurized can. It says sterile on it. When you turn it over to look at the ingredients, all you're seeing on there is probably purified water and sodium chloride. Nothing else. If it has something else, just put it back on the shelf and step away, son, or step away. Now, what you want to do is use that twice a day. If it's the mist kind, just spray it directly on there on both sides, let it stay in contact, and then wipe. If it is the kind that comes out like in a squirt gun, it's usually best to apply that to a sterile piece of gauze sponge or a folded up clean, never been used before, paper towel, and then do a compress and then wipe it off twice daily. Once at the least, twice at the most. Another thing you do is at the end of your shower, pull your hair and everything out of the way and let that water kind of flow over the area. That'll help to remove any additional. Also, it helps to make sure that no soap or any shampoo or anything else collects on the jewelry and agitates the piercing. Now, the reason why I want you to remove that discharge is to allow room for more discharge, and also to eliminate when the piercing jewelry moves, which it does occasionally, the agitation that can create. The other thing you need to do is practice cross-contamination prevention. Common sense stuff. Wash your hands before you handle it. No oral contact or exchange of bodily fluids on, near, or around the piercing. Keep your environment clean. That includes clothing, bedding, towels. Anything that may come in contact with the piercing needs to be cleaned on a regular basis. Do not submerge the piercing in bodies of water you cannot control the quality of, which is everything but your own clean bathtub. I don't care how much chemicals in there. I don't care how clean it looks. There are microorganisms in that water. The piercing is an open wound, meaning that there is a possibility of said microorganisms working their way into the piercing and causing an infection. Keep pets away from it. Don't let them sleep in the bed with you. No matter how cute and cuddly they may be, especially those smaller animals like to sleep up by your face or on the pillow. They tend to contaminate everything, and it's not good for the piercing, especially if they're the kind that are attracted to shiny objects and like to lick them or lick your wounds. Avoid contact with unclean objects. Now, what could that be? Telephones, headphones, earmuffs, helmets, anything that comes in contact with the area that has to be cleaned on a regular basis could possibly transfer microorganisms, foreign pathogens, and cause an infection. Lastly, avoid contact with wet hair. Wet hair can cause issues with piercings. Wear it up in a fun bun or wrapped in a towel until it's completely dry. Now let's move on to trauma, pressure, and abuse. First and foremost, do not sleep on the piercing. Make sure you're sleeping on your other side of your back, or devise a way to elevate it off the bed. Probably the most common or most suggested is a U-shaped travel pillow, you know, those neck pillows you get when you go on a long flight, and then put a clean sock over the pillow so that it's clean every time. Avoid tight-fitting headphones, helmets, over-the-ear headphones, or over-the-ear headphones. Avoid anything that adds pressure to the area. Things like helmets, hats. I don't know why a hat would be that far down. I don't know. Maybe. Over-the-ear headphones. Anything that's going to have a lot of pressure. Also, earbuds or stethoscopes. If you work in the medical industry and need both ears to hear what's going on, this might not be a piercing that's going to work out for you. Do not spin it. Do not rotate it. Do not move it. Do not play with it. Leave it alone. It is not a toy. It's not a fidget spinner. Leave it alone. Once it heals, you can play with it to your heart's content for the rest of your life. But during the healing process, the more a piercing's left alone, the better chances it's going to heal without issue. Already covered this, but we're going to cover it again. Earbuds. They do need to be disinfected if you keep them in the area. Some people have no problems wearing them after it heals, especially if they wear a flatback labrae in it, so there's not something sticking out. Stethoscope's kind of the same thing. You really need to consider this beforehand of whether or not you can take that time period of a minimum of probably roughly about 3 months where you do not have anything in that ear. You may have to listen to all your favorite tunes on mono. Now let's talk about jewelry. Jewelry with this one, my preferred type is post jewelry. Threadless labrae studs or threaded. You can use barbells. Some people like them over, I don't know why. Something about having that flat disc, especially when you finalize the jewelry and you're done, is going to be a lot more comfortable if you use earbuds and etc. It's going to be oversized to allow for inflammation and should be downsized in roughly about a 4 to 6 week period once that swelling is completely done. And I suggest you go to your piercer and have them change it for you. Now, if it's threaded jewelry, you definitely need to check the tightness of the ball or end on a regular basis. They can sometimes come unscrewed on their own, and they usually fall off at the worst possible time and land in the most disgusting thing near you. Ugh. It should not be pierced with circular jewelry, including hinge rings, clickers, circular barbells, etc. I'm not a big fan of doing it with curved barbells. There's really no purpose to it other than, hey, I can stock less jewelry if I stock curved barbells and pierce everything with curved barbells. You might want to find a different piercer if that's the case. If you're dead set on wearing a ring or circular jewelry, I would suggest waiting at least 6 to 12 months before you change it out to a ring, because you are changing it from a straight piercing to a curved or circular or curved jewelry. Part of the problem is that when that piercing initially heals, it's very tight, it's very fragile. You put the jewelry in, there's a possibility of going into that instead of going through it, dislodging the piercing tunnel, and then you're starting the healing process all over again. The other issue is just that curvature in there can create hot spots that can cause problems. You want to wait for the piercing to season, where your body produces additional tissue and thickens it to get it more closer to normal tissue, and also kind of expands a little bit. It's why you can stretch piercings, is because your body will always grow away from the jewelry a little bit. At first, it's going to be very tight. Later along, it's going to be loose. Now let's talk about pain. With this one, it's usually one push, very quick, sharp pain, maybe some heat involved, a bit of warmth. The jewelry insertion, on some cases, depending on how small your ear is and the angle that trachea sits at, can cause a little bit of pulling or tugging during the jewelry insertion that can be a little bit uncomfortable, mostly pressure. Afterwards, you're going to see, sometimes you're going to have a little bit of throbbing, aching, heat in the area for anywhere from a minute to 2 or 3 minutes. Then after that, every time you bump it, every time you touch it, every time it comes in contact with anything, it's going to hurt. It's going to be tender to the touch anywhere from 2 to 3 weeks. It varies from person to person. Some people, after a couple days, they don't even notice it's there. Anatomy. Now, on this one, it needs to be large enough to support the jewelry. It needs to be pronounced enough. Shape of the tragus, because it comes in a lot of different shapes, can also dictate how it can be done and where it can be done. Generally, I do them dead center unless the person has a really large one and they go, hey, I might want to do multiples. Then we will space it a little bit lower, a little bit tight or high. If they say they want circular jewelry, we will take that into account of where a ring is going to look best and fit comfortably hanging straight down. So you should discuss these things when you're talking to your piercer, when you're going through the consultation, and also when they're marking it. Say, hey, is a ring going to fit in there? Can I put another one on the other side? All these things are important. Now, lastly, what you should consider, a few things most people don't think about. If you plan on going on vacation, it might be best to wait until you come back. The reason being is, first off, you're not going to be able to control the environment or the cleanliness of the environment that you're in. And it's going to be a hassle to stop fun time to go take care of your piercing. The other reason is usually, at least in most countries, I guess, you're usually going to a warmer climate and it involves swimming. As I mentioned earlier, you want to avoid swimming during the healing process. Completely is best. There isn't any magical powder or voodoo spell that you can cast that is going to be 100%. It's usually best to wait until after it heals. So if you know you're going on to Cancun in 2 weeks, you might want to wait until you get back from Cancun to get this piercing done. The next one is, are you involved in any type of organized activities like sports, drama, I don't know, whatever. And there is something in the regulations or dress code that's going to force you to remove this jewelry or hide the piercing during performances or competing. There is no safe way to remove and replace jewelry during the healing process. It will agitate the piercing. It can lead to problems. It also can cause loss of the piercing if you're leaving the jewelry out for long periods of time in that first year. After that, you might be able to get away with it. Another possibility would be a glass retainer, but understand that those are even visible. Your best option is to contact your coach or teacher or instructor or whoever's in charge, director, I guess, and ask them whether or not it's going to be permitted and whether or not it's going to cause an issue beforehand. And then if it is, wait until after you're done with that activity to get the piercing done. I know I've already talked about this, but I always like to bring it up twice. Sleep and isolation, very important. Keep things away from it. Do not put pressure on the piercing. You're going to have a much easier heal, and I don't care if it doesn't hurt to do it. That isn't a clear sign that it's not going to cause issues. Piercings have a way of tricking you. They go through these kind of really nice, oh, everything's done, I think it's completely healed, and then it gets bumped, or you sleep on it. The next day, it's got a giant, ugly red bump on it, and it hurts like bloody murder. It is really common. Don't let it trick. Give it time. Isolate, isolate, isolate. Let's talk about stethoscopes and earbuds. As I mentioned earlier, flat back labres are probably your best option, especially after it's downsized and healed, because it's not going to stick out very much. However, there are some people that have claimed up and down they can't wear them anymore for one reason or another, or they wear them and then suddenly the piercing will flare up. You should know this going in, especially if those two items are part of your daily life. Well, like, subscribe, hit that notification bell. Let us know that you liked it, because we like it when you like it. If you have anything to add or you'd like to ask a question, please comment. I usually answer when I can. Check out our merch store. Links in the description. Till next time, here's hoping all your piercings heal with ease and without a single issue. And if you're in the Des Moines, Iowa area, I hope to see you for your body piercing needs in the future. Have a good day, everybody. Take care, and check out one of these other videos floating around here.